Welcome back. With the statewide mask mandate recently extended another 60 days for people 5 years old and older, parents may need a little bit of help in getting the kids to stay on board. We are joined now by Dr. Barb Calkins. She's a pediatrician with Children's Wisconsin. Dr. Calkins, great to see you again. Lots to get to. So let me ask you first for your medical opinion, because there's a lot of conversation about this, on whether masks are indeed an effective strategy for limiting spread of coronavirus.
Yes, absolutely. And I firmly believe that if everyone can wear a mask when we're out in public and social distancing isn't possible, it definitely will help reduce the spread of respiratory droplets as we're all speaking, and those droplets are inadvertently being sprayed while we're talking. So absolutely.
It's kind of like a car seat, though. If you're not in the car seat right, it doesn't do its job. If the mask isn't put on right, it's not going to do what you need it to do as well. Can you get into a little bit of what we're seeing and people wearing it in the wrong spot or touching it and things?
Yeah, absolutely. So the first and most important thing I would say is that when you wear a mask and you're putting your mask on, you would want to start with washing your hands with soap and water or using hand sanitizer, which I have here. When you're putting your mask on, you want to make sure that you're holding the straps and not touching the front of the mask where there's potentially drops or germs on it. And you want the mask to be covering your chin and the top of your nose and fit snugly as such. And once the mask is on, ideally it wouldn't be touched and you wouldn't be touching your eyes, which can spread germs. I think the way you don't want to wear a mask is having it halfway off your face where your nose is uncovered, having it underneath your chin, which has no effect at all. Wearing it on the side of your face will not protect you at all as well. So again, I think the covering of your nose and mouth is very important when you're wearing a mask. That is how your respiratory droplets will not get spread to other people.
I've actually been fairly impressed with what I've seen from kids. There seems to be pretty decent compliance, but if you got a kid who's a little bit stubborn or is worried about it or not fully complying, are there things that you can do with that child to help them?
Yeah, absolutely. And I would agree with you. I think that the younger children are actually very compliant with wearing masks. I think helping kids understand that when they are attending school or going out in public, masks are the way that allow our kids to be able to be with other people without acquiring germs that could make them sick or making other people sick. And you can certainly make it more fun if you have their mask, have their favorite character on it, or match their clothes, or be a specific color. And you can role model this by you wearing your mask and showing them that this is an easy thing to do, and reassuring them that the mask allows them to breathe and get oxygen in their lungs. It's not going to reduce the amount of oxygen that they get or airflow. So, and we sometimes have kids practice it at home while they're watching TV or playing a video game or doing homework, or in something that they're doing where they're distracted, that they might not even realize they're wearing their mask. So there is ways to get kids to get used to it even when you're at home.